Are you ready?
Yeah, I'm ready.
Okay, so why don't we start with, how did you get started on Angsana? It's already.
Sorry.
Yeah.
Dry mouth syndrome.
How did you get started on Angsana Care?
I actually didn't get started myself. It was Dr. Loh E. Chin, who is one of our medical advisors. She is also the palliative care doctor of the University Hospital of Malaysia. Now, she started a pilot program, ran it for 3 years with a music therapist. Okay. When she found that it was really successful and it needed to go bigger and, do more good, that's when a common friend introduced us, and it was introduced, Sharon as well.
Okay.
And that's when it was something I took on and took very seriously, and yeah.
What were you doing previously before this? Like, is this something that you've always been doing, or?
Yeah. Resonates with me because I'm a hypnotherapist. So therapy per se resonates. But I come from a background of a lot of charity work. My mother was a staunch believer of charity work. She was a social worker in Singapore and in Malaysia. So the time was right for me. I attained this wonderful age. And I think with maturity comes a certain level, a certain need to give back.
So you felt that there was a need to give back. You've done a lot of charity work, like you said, right? And you come from a background. What was it about this particular program or this particular work that Angsana Care is doing that resonated with you? I mean, you have a whole gamut to pick from, right? Why would you pick something like that?
Yeah, because I actually advocate for the quality of life for all children. All children who are well, healthy, running around, going to school, as well as children like ours who have life-threatening and life-limiting diseases, who live in hospital and are suffering the stresses of that. I do believe that they equally deserve a quality of life.
So you mentioned, on your site, it talks about giving children and their families a change of focus, right, to reduce fear and enjoyment and to have more enjoyment in their last days. What does it mean for families and their children to change their focus? Like
Yeah, well, let's take the family, for example.
Sure.
Now, a family, let's take parents. Now, when parents hear that their child has been diagnosed with a disease that is, as I said, life-limiting or life-threatening, which means that they go into palliative care, the stresses, therefore, thereafter, and the fear they start to feel becomes their sole purpose or sole focus in life. Now, we feel the need to counsel these parents because the more stressed they become, the less of a family life they're able to provide for the sick child as well as the other siblings. Now, the reason we give counseling to the caregivers and the parents is because we find often the marriages are falling apart because they're already underprivileged. So one parent now has to stop working to look after this child, and because it's a child living in the hospitals. Income is now halved. There are siblings at home. The stresses just mount. So we feel that the parents need to change their focus by changing, well, for the parents' focus, we really are basically counseling them and calming them down to cope better with the situation. When we're talking about the focus of the children, really it is the focus of the children that we are working upon. That's because a normal child goes to school, has a normal family life, lives at home. We can't give the child home. The best we can do is to give them a more stable family environment. So therefore, going back to the counseling of the family. As for the stimulation of school and everything else that a normal child would have, we replace that with the therapy work that we give them. Now, the child attends a therapy session and thinks it's fun. You know, there's art, there's music, there's play. There's very serious therapeutic work taking place.
Really? How
Yeah.
so?
Because the therapists actually know how frightened these children are. The children, as far as they understand, every time they are touched, not by their caregivers or parents, it's a poke, it's a prod, it's machines, it's injections. So they've developed a lot of fear. Now, this translates into them becoming very difficult for doctors to treat. So you may not know this, but the doctors refer their patients to us. Now, the reason they do this is because they find that after the therapeutic work, children are far more accepting of treatment and not so fearful. So the focus we need to change is from fear to acceptance.
So in terms of, like, when you talk about the parents, right, you talk about the change, to counsel them to change their focus. How do you get someone to think about something else other than the disease, other than getting treatment, other than, you know, like you say, the income is halved. You know, we have these real struggles. What kind of focus then will you talk to them about? Like, you need to...
Right, it's more
yeah.
de-stressing. It's more de-stressing where the parents are concerned. It's more acceptance that their child might go. Nobody accepts that the child might die. Not all of our children die, okay? But some do, some pass away, and parents are guided into feeling stronger and coping better rather than falling apart. With the therapy, this is what they're able to do, or this is what we try to do for them, teach them better coping skills.
Okay, so for parents, it's counseling and mainly how to deal with the stress. For the children, it's the art, the music, and the play therapy. So for kids, the fear, you talked about the fear of being prodded, and you know, I think it's pain associated with treatment. What other fears do they have, children?
Okay, it's an unnatural environment. It's a hospital environment. These children are not naturally meant to live in a hospital and not socialize. They're lying in bed, they're stuck in bed, in other words, you know. That is not a child's life, not what it should be. But to be treated, there's no choice. They have to be there. It is fearful. It is unnatural for them.
Do they talk about the end? You know, like what would come?
Most of our children don't know that they are that ill. And they don't even understand the concept of death yet, most of them. Their fear is more related to the pain, to the unnatural circumstances, and to the stresses their parents are showing, you know, exhibiting. Those stresses naturally affect the child. And we also try and counsel the family, because when and if a couple split up, this child then starts to bear the guilt that their siblings are being untended to. We have children who end up on the streets because the families have split up. So the work we do, yes, although it's centered around the patient, actually encompasses the whole family.
You mentioned quality of life. What does quality of life look like or mean, or you know, the kind of goal that you and the therapist work with for patients? What kind of quality of life do you want them to have? So we hear this term bantered a lot, you know, like, you know, don't just think about the illness don't define you, there's more to your life shouldn't just be, you know, it's more than this. But what exactly is more? Like, how do you decide, or how does the therapist decide?
Okay, first of all, our therapists are highly qualified people, very experienced people. So during a session, they understand what the child needs. And as chair of the society, it is not in my place to get involved there. They know what they're doing far better than I would, you know. So I leave that to them to make the judgment call as to what the child needs next. As for quality of life, I'd say every child deserves to not spend all of their time unhappy or depressed, which is likely if you were admitted in hospital, unable to socialize, unable to run around, you know.
So we met Naeem today, right? And we've seen how just having a hope, and he talked about he was motivated by people at Angsana Care talking to him and giving him, like, telling him about little goals that he could achieve, and motivated to just get better and to get stronger. Do you have any other examples, 2 or 3 perhaps, you know, of individuals or families who have gone through this and you actually see the change in their quality of life as a result of intervention?
Sure, sure. We have many stories, but I'll hold myself back.
Sure.
Now, we had a little boy, a 5-year-old, who had leukemia, and he'd had a bone marrow transplant. Now, treatment thereafter required him to stay in hospital for 3 months. This little boy was used to running around like a normal kid, you know, playing. He found that being stuck in bed and unstimulated was terribly frustrating. And he developed this habit of screaming.
Oh.
He just screamed, and I think drove all the staff to their wits' end. Mother was in pieces. She would buy storybooks, movies, games, toys for this child, but he very quickly got bored of it all. It's at this point that the doctors referred this child to Angsana Care. When our therapist went in, it didn't take too long, but we found a happy child again. He stopped screaming. He found he enjoyed playing the drums, for example. He was singing songs, creating art, and just a normal happy kid, in hospital albeit, you know. And his mother was so relieved, it was all over her face. So that's one child I could tell you about. We've recently had another story I can tell you about. There was a little girl in hospital who's seen the therapist for a few sessions already. At this point, the doctors came in and gave the parents some very sad news, that they said that their child wouldn't last more than a couple of days.
Oh.
Being parents who were trying to give her everything they could in her last days, they asked her what she'd like, and all she seemed to want was time with a therapist. So our art therapist, Rena Claire, she's just wonderful. On her day off, on a Saturday, she rushed in and spent time with this child. I'm happy to say that when this child passed on, both she and her parents were in a calmer frame of mind. That, to me, from Angsana Care, is a success story.
So it's not about how long they live, it's not about whether they make it through, but truly when they are living, you know, how their days were spent.
Absolutely. We do focus on the fact that they are living, and they need stimulation, they need some joy, they need creativity. They don't at that point need schooling. We can't provide that, but they do need mental stimulation to take them away from what the reality is.
In terms of the challenges of running an organization like Angsana Care, we know that a lot of NGOs and charities or social impact organizations face this issue of funding. That's one, you know, getting help to run their organization. And often funders these days would want to give to a specific cause, or they have a very clear idea of who they want to give or the kind of beneficiaries that they want. It's just part of their own KPIs, right? Do you have challenges in this area?
Yes, we do. Yes, we do. We have, I'm faced, I wouldn't say frequently, but it has happened with donors who would say that they'd prefer to donate to a child that's going to live and be healthy and continue for a long time, so that money goes further. Again, it goes back to the quality of life of the living. I have very little to say to that, other than I think we all need to put ourselves in somebody else's shoes once in a way, to be underprivileged and to have a child who's gravely ill, to actually be that person and understand where that's coming from, might help people understand that if they had a child like that, they'd want help too.
Do you have difficulties getting volunteers or therapists coming to do this work? Because it's not really mainstream, isn't it, this therapy?
No, it isn't, and volunteers are a huge problem for us. People do want to volunteer, and we love the fact that people want to help. But because our children are so fragile, the volunteers we are able to accept have to be highly skilled, very experienced, and know what they're doing with these particular children. Now, we have 4 amazing ladies who volunteer, but they are precisely what I said. You know, they are very highly skilled. They have a lot of experience with dealing with these children. We will one day, as we handpick them, have more. Now, these ladies give group sessions to the kids, again, for nothing more than to take their focus away, to give them some fun, some creativity, some time away from being ill.
So when you say you handpick these volunteers, what is your criteria? Do they need qualifications for this?
They need, yes, qualifications, specifically in art and music and in handling children and teaching children.
Currently, you're running this only at one hospital? Or?
We work with the Pediatric Institute of Malaysia, which is in the General Hospital, the largest hospital, and the largest catchment of ill children. So we don't intend at this point to move anywhere because this is all we're able to do at the moment.
How many people are running Angsana Care right now? Yourself, and how many people?
I have the most incredible committee. There are 8 of us. It's a core group of 5.
This doesn't include the therapist, right?
No, not at all. Not at all.
So there's 8.
These people are all volunteers, and they are just amazing. Without them, we would not run.
How do you overcome, like you talked about, there are challenges like any other social impact organization. What keeps you guys going? You know, talk about a rough patch perhaps that you've had, and what kept your committee going?
Each other, actually. We all, it's the work we do can get you down, obviously, because we see very sad cases a lot. Now, it can get you down, and sometimes some of our volunteers are exposed to heart-wrenching scenes. So it gets you down, but what we all do is, you know, we hold each other up. That's why it's a committee and a team that work remarkably well.
So your committee actually is hands-on as well? So
yes,
you do go down to the
absolutely.
hospital? Yeah. Ah, okay. And your committee members, you're all trained as well, like you're a hypnotherapist?
We're not all trained in the field, so the ones who aren't actually hands-on in the hospital. We might go into the hospital where we're not actually dealing with the children. Okay. The likes of me, I don't deal with the children at all, or with the families. I might meet them on occasion, but I don't give them therapy. I don't give them therapy, nor do I give them sessions in art and music, because that's not my field at all.
Looking ahead, what do you see as some challenges, or that may loom ahead, and how do you think you can overcome them?
Well, let me tell you about a challenge that we felt was insurmountable when we started. How to get doctors to refer their patients to us. I'm happy to say that no longer is a challenge. They've seen the work, they trust us, they refer every patient to us, either them or the other medical staff in the hospital. So that's no longer a challenge. One of our big challenges currently is getting parents of the children, of the patients, to trust us. Understandably, when they know their child is that ill, they're fearful that anything can tip the balance. So when our therapists approach a patient, often they are told by the parents, oh, you know, my child is really not feeling so well today or is down today, so come back another day. What we need to get them to understand at that point is that's precisely when the child needs to be worked with, you know. So that is a challenge, but it's something, you know.
How do you get the doctors to come around to this? Like, do you guys do a study?
There are studies. There are studies worldwide to
Yep.
show
Yep.
from various universities to show that this is a science that actually works. But in our case, we have children that they found they couldn't deal with. That with a few sessions, simply because the child calmed down and was more relaxed and they had other things to think about and look forward to, they were happy to go in for treatment. So for the doctors, that in itself was much that they needed.
So it was really like a lot like on the job. They see things happening, they see the changes, and that's how you won over.
Our doctors as well are very well read. They know about this. I guess in some ways they've probably been waiting for it to come into Malaysia. You know, this is not a service that's been provided in Malaysia before. So I think they were quite open to it.
Are there plans to scale up for your
In what
for Angsana
sense?
Care in terms of getting more therapists or?
When we
Going
have
into
more funding, we would love to see more children. There are more kids in that hospital than we can tend to at the moment, than we can afford to. Our funds all go to paying professional therapist fees. So we do as much as we can at the moment, you know. Scaling up would just mean seeing more patients.
So it's just repeating and doing more of what you're doing, but so it's the funds that's limiting right now.
The funds are limiting, yeah.
Okay. There are enough expertise around to hire.
Well, if nothing else, we could get our therapists to work for more hours.
That's true, that's true.
No, these therapists are very hard to come by. I could count them on one hand, how many there are in Malaysia, as skilled and as experienced as we want them to be.
Okay, just some numbers right now. Like how many children have been helped in the past year?
Well, we've just completed 1 year's service in the hospital's premises. In the first 6 months, we only had 2 therapists. In the last 6 months, we have had 3. But in total, now with 3 therapists, they see about 90 to 100 sessions a month. But by sessions, I have to say that these sessions include patients, parents and caregivers, and all these patients and parents have more than 1 session. So we're not counting how many patients we've seen. Now, in terms of how many children between the ages of 3 months and 17 years that we've seen, that would be about 260 in the last year.
Wow, that's a
not
lot.
including the parents.
That's a lot. 3 months. What do you do with babies who are 3 months old?
Well, we do have play therapy. We have baby massage sessions. Mothers of very young babies are actually taught to give specialized baby massage. That's a separate service we provide. But in those instances, it's more the mother or the father, whoever the caregiver is, sometimes it's grandparents, who require the sessions, the counseling sessions.
Okay. Any final words for whoever's going to watch this, you know, people on Catalyst Asia, to tell them about Angsana Care and to get them on board in whichever way they can. This is your plug.
Now you have me stumped.
It's okay if you, yeah.
You know, art, music, and play therapy are mainstream in most countries that are developed, okay? in the hospitals. They don't come in as a charitable society trying to do good. It's already part of the hospital system in most countries. In Malaysia, this is a first. There are other organizations that do it, but on a volunteer system. This is different. We are different in that we actually engage the services of professional therapists, which is why our doctors appreciate the work that's being done. Volunteers are wonderful, but volunteers aren't trained to handle children this fragile. What we do affects lives, and we know we're making little lives better. And the work we do encompasses the entire family, you know. So we're happy to say that this work actually extends to entire families who could sometimes end up on the streets. So we feel we're doing an extended job beyond just the patient. The team I work with are an extraordinary bunch of people. I could not ask for more passion and commitment. All I can say is that we've got our hearts in it, and everybody's wanting to see this keep going. Our well-wishers, the corporates that support us, but mostly the individual donors, give us trust purely by giving us their hard-earned money. And this trust in itself sees to it that we have to keep our work going. You know, we have to keep this work going.
Good. Thank you. Okay.
Do you want to ask her about the story of Naim so that we can connect the story?
Oh, you want that? Okay. Oh, so that the film goes. Okay.
Anything more I need?
Who would be talking about Naim's story? Are you able to so what you can do is from here
I think that would be Miyun's story.
Miyun? That's the
Yeah.
next one. Okay. Sure.
Yeah.
All right.
Did she say what time she's coming? Sorry. we're
Miyun
off.
is 6, I think. 4 or 6. Okay, it's all right. He has it in the
4:30 and Padma's not here.
It's 4:30. It's not.
4:30. Yeah. Sorry, I couldn't get chatty with you because my mic is on, so I have to be careful and not talk, because if not, you'll have That's why I kept looking at him
No, that's fine. That's fine. That's fine.
You need
As
to
long
have
as
it,
I
yeah.
wasn't too stilted.
No. Was it all right?
Say anything about Naim
No need.
now?
It's okay. We'll ask Miyun. Yeah. You need any cutaways?
Maybe I should mention Naim to introduce that.
Sure.
How
Okay.
do I say this, or what shall I say?
I can. How? We said one of the talk about Naim, one of the other cases. One of the happy stories that we have of a teenager who's recovered.
And you're going to cut
Or
and
who's
paste
gone
this,
into-
right?
yeah,
to
yeah,
somewhere
yeah.
else,
Yeah.
obviously, yeah. Let me just think about this, Naim. Yeah,
Yeah.
okay. We have, you're on? Is this on?
Hang on. Yep.
We have another lovely story where sometimes we dangle a carrot in front of a child, okay? And as much as it might seem that we're buying, their interest in what we want them to do, our therapists sometimes find that it helps to ask them what is a dream that they might have. So we had this young man, boy, he was only 13 to 14 then, who had been through chemotherapy, and he'd come out of it, but was totally unmotivated to get up and start moving and living life. Our therapist, Miyun, at this point asked him what was the one thing he would want to do or have, and he said he'd never been on a plane. So on our behalf, she promised him that Angsana Care would put him on a flight. And the happy story is that this child felt challenged to get up and start walking, because she did say to him, you can't get on a plane unless you're up and walking. Now, as mercenary as that might sound, it really is a carrot to motivate the child to get up. And that was a great success story, because he was up, he got himself well enough. At some point the doctor said, you know, you might be walking but your heart's not strong enough. He worked at getting well. And so we have Naim now on a flight, tomorrow in fact, going to Penang, staying there for a couple of days and coming back. So sometimes, yes, we do give them little dreams, you know, fulfilled.
Are you okay with it? Yeah? Okay.
So let me redo that last sentence, Ken.
Sure.
So sometimes we do fulfill their little dreams.